the second wave in India is so virulent and lethal. Usually, COVID usually affects a little bit older age group, and
Right.
usually the symptoms start of 1 week and goes to second week, and it becomes serious after third or fourth weeks. But this wave is hitting the young population very hard, in like who are in low 20s, 30s, 40s, and the symptoms are starting in 3 to 5 days, and deaths are happening within a period of 2 weeks. This is a very lethal virus, lethal strain, and it's the prediction is almost there'll be almost 1 million deaths in India soon. It will
Right.
cross the 1 million mark.
Right. Doctor, do you think that's still an undercount of the deaths that could be
Oh,
possible?
definitely, definitely. There is we can easily add another 2 to 3 times of the deaths reported. Part of the reason is, especially in rural areas and also in the hospitals, they are overburdened, and they are not able to report the accurate number. I think there are at least 2 to 3 times, even times more deaths
Wow.
than that's what's happening.
Wow. And doctor, I'm sure you are connected with several Indian physicians in India. We're hearing horrific stories of hospitals, of ambulances, of everything being run out. What are you hearing? What do you know so far?
I think it's the healthcare is not system is not able to cope up with the demand. So many deaths happening, so many infections happening, so many admissions. There is shortage of beds, there is shortage of oxygen, there is shortage of medications. There is shortage at every level. It's so hard to cater for so many millions of people, and the government is doing the best they can. But again, when people get frantic, they try to get whatever they can, and try to rush for it, and especially for asymptomatic patients or some of the mildly symptomatic patients, they are rushing for treatment, they are rushing for admission, even though there are some patients who does not need admission. They are pushing themselves to get admitted. So there is already existing overburdening on the system, and people in frantic, they are becoming more, causing more and more burden on the system.
You know, Dr. Reddy, I'd like to ask you, do you think or did you expect this oxygen issue to happen in India?
It's not only oxygen. Oxygen is one thing, but
Right.
there are multiple things. Even like coming to the hospital, the beds are short. There's shortage of beds, the oxygen. There is ventilator shortage. Even the funeral places, there is acute shortage. Like
Yeah.
you can see people like waiting for the one funeral to be over so that the next funeral can happen right away. So there is shortage at every level, and oxygen is one piece of it. And of course, when the system is overburdened with so much population,
Right.
yes, that's one of our predictions that if it happens, there is definitely shortage of everything.
Right. You know, Dr. Reddy, the government, because it declared victory over COVID in January in India, allowed for a huge Hindu festival such as the Kumbh Mela to occur with millions of Indians coming there together unmasked. They also allowed for election rallies to continue with people unmasked, with thousands of them there. How much do you blame this on the effort of the, or not, or the lack of effort of the government to this surge? You know, who is to be blamed?
I think the blame it will come to the common person.
Hmm.
Even though the government said they claimed victory, they always said, be careful, you have to be cautious, you have to continue wearing masks. And people stopped believing that the virus ever existed. Some of the people I know, they said, oh, there is no infection in India, everybody's going freely. But even the government was giving strict precautions. I won't blame the government. I think they were doing the right thing. They were trying to open up the economy, because that's the only way the country can move forward. We cannot sit at home and not do anything. We have to move forward, but we have to be careful too. The people have to be careful. They could easily wear masks, and they could easily maintain social distancing. They can easily do the sanitization. Those have to be followed. We are still in the
Right.
pandemic. The WHO has is did not announce that the pandemic is over. The pandemic is still, we are still in the phase of pandemic. And we should be careful. That's what is happening in United States. Even though the cases have gone down, people are still careful. People are still using sanitization. They are using hand sanitizer. They are using masks everywhere. And government can only do so much. It has to come from the public.
Right. And when you're looking at the surge again, doctor, what's your prediction for this month and the next month in India? What's going to happen there, according to you?
It's going to be very bad. I think the official number of deaths will cross 1 million or even more. It may even go to 2 millions because it's out of control now.
Right.
Deaths are happening so fast. And there was time when people didn't want to take vaccines. Even I know some doctors who didn't refuse to take vaccines because they thought it's over, we don't need it, and that's part of the reason it's affecting so bad. And that's I think this disease can only be controlled by the people, not government. Government can only help, but the people, it has to come from the people. And we know it's easy to control. You wear a mask, you maintain social distancing of 6 feet or 8 feet, and you be careful and use hand sanitizers. This disease can be controlled.
Right.
But there was a complacency, there was some misinformation from the people that, oh, this disease is very mild, we don't need to worry about this disease. So that's where I think it came back so badly.
Do you think, doctor, that perhaps having a massive vaccination program is the only solution out? And following that, the Biden administration has said that they will likely share important information, the IPs for the vaccines here, Pfizer and Moderna, with India. Do you think that would help?
It will definitely help, especially because on the humanitarian grounds,
Right.
the patents can be released. And India, the problem in India is it's not only they develop the maximum number of vaccines. I think the vaccines, they do have vaccines. The people are the ones who refused vaccines. There are several incidents where people refused vaccines. That's part of the reason. I think we try to educate the people even from the United States, and also we did several distribution of literature and media. Vaccines are mandatory. You have to take vaccines. That's around 11% of Indian population are vaccine. They have vaccines. But actually, we had a meeting with Reverend Jesse Jackson yesterday, that there are 60 million vaccines from AstraZeneca to be distributed to India. And they are not being used in the United States, but they are approved in India. And we would like them to be distributed there. And every person, the country has more than billion population.
Right.
It's very hard to vaccinate everybody, but that's the only protection we have right now.
Let's not talk about the United States, doctor. I have a lot of questions on that too. My first question to you is, we're hearing from experts that the case numbers are going down and the death toll is going down. Is it time for us to sort of be okay with this positive news, or are we still not okay with COVID-19 right now?
Until the WHO announces that the pandemic is over, it's not okay. It's not okay. But the problem is we are in a state of frozen. Like but we have to move forward. We cannot just stay still like that. We have to move forward, but cautiously. It can come back and hit us very bad again. We have to be prepared. Now, everything, even if you look at the oxygen tanks, the ventilators, we are importing from China. Like India is importing from China. Every country should try to be self-sufficient, at least in the basic health facilities.
Right.
Until that happens, you cannot depend on one country to produce all these, like the masks. When we had when COVID hit us, we were running after China, running to China for masks. So we cannot do that. We have to be self-sufficient in the basic healthcare facilities, and we have to develop on those. But we have to move forward. We cannot just be in a frozen mode. But again, we have to be careful. It's not over. We are still way behind. It's going to come back, and we have to be very careful.
Right, and you just mentioned mask, doctors, and that was going to be my next question to you. CDC released some guidelines for vaccinated people. President Biden also announced those guidelines for vaccinated people where they could be unmasked outside in certain conditions. My question to you is Is it too early for them to say this? And do you believe we should still be masking ourselves no matter where we're going?
I think that's a release by CDC. We should follow whatever the CDC guidelines are, and it's a relatively safe. It's not 100% safe, but we cannot live in a way of constant fear. But again, we have to be very cautious and judicious. The reason it was said that if you wear a mask and if you are an outdoor, and if with a limited group of people who you already know, that means that the chances of infection are less, but doesn't mean it's zero. So you still have to be cautious. If anybody has symptoms of fever or cough, you have to be careful and stay away from them. And so you still have to maintain precautions.
Right. Doctor, what are the chances of a vaccinated person getting COVID-19?
There is very minimal chance. There is a chance because there are multiple strains going on, but the chances are extremely low.
All right. When we're talking about the vaccination program right now, I have some questions on the vaccines right now, Doctor. Are you happy with the progress that the vaccination program has made so far, or do you think we are still limiting ourselves with the people we're trying to reach with the vaccines in this country?
Because this was done on a record scale. Within a year, we were able to produce, even less than a year, we were able to produce a vaccine. That means we don't know the long-term effect. We don't know what happens 5 years from now, 10 years from now. So these are not time-tested. These are laboratory-tested. So we have to be careful when we give them. So that's why they are doing in a stage-phase manner. And you have to do that and make sure. First, it started with first responders, the physicians, the police, the fire. Then they opened up to the seniors. Then they opened up because we have to make sure we have enough vaccines. At the same time, we have to make sure no long-term complications come from these vaccines.
Right. And when you're looking at these vaccines today, Pfizer and Moderna both said that their new booster shots are effective against some of the variants of coronavirus. My question to you is, when would we have to take these booster shots if you're already fully vaccinated?
As I said before, we are still new in the phase. We haven't even had a year of watching the results of the vaccination. So it's still in the, we can say it's still in the research phase, in the sense that we are just still looking for the results. Nobody knows when exactly to give a booster dose, how long the booster dose is going to last. And so it's still in the learning phase. We are learning as we are flying. So.
Right. And meanwhile, Doctor, getting vaccine doses into children has now become a huge focus of Pfizer and Moderna. What details could you give us about that? I know right now they're looking at 12 to 15 years old, getting them inoculated, but there is news that we're hearing that it could also go from 2 to 12. What information could you provide us on that?
At this point, it's still preliminary, but especially when you go to children and kids, the problem is their developing age, their physique is developing, they're mentally developing, and nobody knows what will happen with this vaccine 10 years, 20 years from now. Who knows, it may affect their neurological development, their physical development. So that's why they are being extremely cautious, and I fully support being cautious. And but again, we don't have the full results. We'll know after 10 to 20 years. We know exactly what this vaccine does.
Right. But these children getting vaccinated, Doctor, if that happens, will we reach herd immunity then?
Herd immunity usually happens when 60 to 80% of the people get vaccinated or infected. But at this point, it's too early to say, because this virus is not a regular virus. All the other viruses we know, this has some kind of genetic information that's kind of very complicated to understand. It's changing its shape, it's becoming virulent. In the beginning, we don't know. The children were totally protected from the virus, and there was no reason why that happened. So we are still in the learning phase, and this virus is changing its shape. It's a very complicated virus, and we still don't have a real handle on this virus.
Right. And also, doctor, currently states are planning reopening, even states including New York, New Jersey, Connecticut. We were the epicenter once. And that news is
Right.
following in several states. Is that a wise decision for us to open up in the month of May?
I think if you look at last time, I think the summer was the best time. I think summer kind of, because people like to be outdoor and the infection rate kind of slowed down in summer. So maybe this is a time to slowly take a cautious step. But again, it's all baby steps. You're walking on eggshells, and you have to watch out. And the one advantage of this disease, this virus, is it's not a virus you will get infected today and your symptoms come out like 3 months later or 2 months later. They come out within a week.
Right.
So that gives a little bit more handle that if something goes wrong, you can right away fix it.
Right.
Because you don't have to wait 3 months to know results. So, like some other infections, it takes 3 months before you even know that person is infected.
Wow.
So,
Yeah, go ahead.
thank you, Aditi. Go ahead.
Yeah, I just have two more questions left here for you, doctor. How are you looking at the next 2 months with the United States? Are we going to be stable in our cases and deaths? And do you see the vaccination effort go up?
I think the vaccination effect is already going up, and I think they have opened up to other age groups, and a lot of people are taking. Unlike in India, people kind of refuse vaccination. Here, almost everybody are taking vaccination. I think that's the right thing to do. And the more we get vaccinated, the more we will have a better control. The one thing, the problem is the world has become so small and it has become global. So people flying all over the countries. We have people coming from every country to United States on almost on a daily basis. So that's kind of a little bit difficult. Maybe the government can look into that and try to quarantine and triage those the population that coming from other countries. I think from India they stopped from yesterday. So that's a great news. I think that's the only way we can control and try to quarantine and limit the disease to few people. But I think I'm very optimistic in the United States. I think we learned the lesson. We are in a better shape to handle any future disasters.
Yes, let's hope so, because we cannot see that devastation again in this country. It continues to still occur. My last question to you is, doctor, I'd love for you to give some advice to South Asians that are at high risk. Even if they are vaccinated, we're hearing from experts that they still have to be super careful. I'd love for you to give some comments on that.
Yes, so for the South Asians, there are two things. One thing is South Asians in India. They have to wear masks, they have to maintain physical distancing, they have to use sanitizers. It's very hard in the cities, the amount of population we have. But in the villages, they have a lot of free land. They have actually the disease is more controlled in villages because they are outdoor most of the time. And I think it's a summertime, so hopefully that will also keep people outside the house or inside the house. So the more these are the three basic precautions. If you follow, I think it may be controlled. I think I am hearing some news that it's already slowing down in some places. And coming to South Asians in the United States, I think we are blessed with huge houses and big outdoor spaces, parks and gardens. So I think take advantage of those. Try to be outside, outdoors, and you please take vaccine, because we are at a luxury to get vaccine. Almost everybody will have the opportunity to get the vaccine in the United States. So please take the vaccine, but please maintain social distancing. Don't be complacent, and wear masks and use hand sanitizers. At least for the next couple of years. This is not going away in a year. For the next couple of years, this is going to be here. So get used to the new lifestyle and try to be careful.